Let me ask you, is there a medication room either in the emergency room or adjacent to it? Yes, there is a locked main medication room. Is it a separate room? Yes, it is. And is that a room where potassium is kept? Yes, that is correct. Isn't it a fact that the nurses or whoever wanted to get potassium can go in there and take it out? Yes. And don't have to sign for it? That is not correct. It's not correct, you say? Defendant's counsel, objection. Counsel doesn't have to echo the answer. The court, yes, avoid repeating the answer as much as possible. Plaintiff's counsel, I will do my best, Judge. The court, that's all we can ask. Next question. The nurses have to get an order. They have to get the potassium, and they sign. Do you remember the name of the last lab technician? I don't know who the technician was. Male or female? I can't remember. Do you recall if the patient had been at the hospital prior? No. Defendant's counsel, I submit whether she was there before is irrelevant. The court sustained. It is not a matter of the acoustic ability of the patient. Do you recall this morning telling us there were 3 leads? Those 3 leads constitute 1 lead on a monitor strip. When I refer to leads, I'm referring to what I see on a monitor. Did you make any inquiry at the hospital with the pathologist as to whether a person could ingest that much potassium, as the record discloses, to get to the level of 10? Did you personally? Did I make any inquiries? Yes. No. Did you ultimately break or speak to Dr. Green? Yes. After the code was over, I called Dr. Green to discuss the whole case with him because I had a lot of questions. Was one of the questions whether Mrs. Horn could consume enough oral potassium to create this kind of reading? Did you ask him that? Defendant's counsel, I object on the ground this would be hearsay, Your Honor, as well as palpably leading the court. Objection sustained. Let me ask you, let's say a person consumes pills or tablets, whatever it happens to be, all right, and if somebody takes a look at that person's stomach, wouldn't there be some debris from those pills, something left over in the stomach? The court, are you asking a hypothetical question? Plaintiff's counsel, in a manner of speaking. The court, doctor, can you answer that question? Yes, well, it depends on how much time has elapsed since the pills have been taken. In any event, there would be some debris, as you say, at some time after that person consumed the pills in the stomach. But like I said before, it depends on how much time has passed since the pills were taken. Now, the person who would consume a large quantity of, let's say, pills of any kind, wouldn't they vomit? It would depend on the pills, obviously. How about the potassium pills? Wouldn't a person vomit from an alleged quantity of potassium pills? I would expect them to, yes. Defendant's counsel moved to strike the answer as sheer speculation. The court sustained. Shouldn't the potassium pills in large quantity leave a more or less corrosive effect on the esophagus or the stomach, in your opinion, with a reasonable degree of medical certainty? Like I said before, it depends on how much time has elapsed and how much has been taken. Can you answer that question? Actually, counsel, it is a question that a medical examiner is more suited to answer than I am. I am an emergency room doctor. I treat acute conditions as they come along. The court, so are you saying, doctor, that you would prefer not to answer that question? Exactly. I thought maybe from your general knowledge you could give us an answer. I haven't done autopsies on people who have overdosed on pills. That's my point. The court, are you saying that is not your field of expertise and that's why you can't answer it? That's what I am saying. Let's talk about people coming into the hospital with an overdose of pills. Wouldn't you think that there would be left a corrosion of the stomach or of the esophagus with certain pills? Can you answer that question? That's not my field of expertise. That I can't answer a question that I don't understand. The court, if you don't understand it, don't answer it. Let me ask you this. Were you aware of the protocol that was needed to treat hypokalemia, or rather hyperkalemia? You're getting confused now between hypo and hyper. There's a big difference. What is the difference? One is too little, the other is too much. Let's get to the hyper. That's above normal? Yes. And the hypo is below normal? Right. Has there been a protocol for the treatment of hyper, that is, high kalemia? Yes, there has. So there are two different treatments, is that correct? Correct. And at that time, when she came into the hospital, you did not know whether she had hypo or hyper. I did not know. Defendant's counsel, Your Honor, I object. Where are we going with this line of inquiry? It is immaterial, I submit. Let me ask you, is there a medication room either in the emergency room or adjacent to it? Yes, there is a locked main medication room. Is it a separate room? Yes, it is. And is that a room where potassium is kept? Yes, that is correct. Isn't it a fact that the nurses or whoever wanted to get potassium can go in there and take it out? Yes. And don't have to sign for it? That is not correct. It's not correct, you say? Defendant's counsel, objection. Counsel does not have to echo the answer. The court, yes. Avoid repeating the answer as much as possible. Plaintiff's counsel, I will do my best, Judge. The court, that's all we can ask. Next question.
I'd say that's a pretty tricky spelling. Hyperkalemia. It's not an easy spelling.
It's K-A.
I know. But that threw me off the first
yeah.
time I saw it in print.
Oh, yeah.